Hi, it's Peter Herku, and today I would like to talk you about Corona crisis. Everybody's talking about, so I really hesitated. Should I talk about it or not? The reason that I decided to do it because in these days on television and the news you hear all kind of legislations or laws that politicians are trying to make to reduce this COVID-19 crisis. So that made me think, okay, if I were them, what would I do? And my name is Peter Herku, and I like solving problems. I like helping companies to improve their efficiency by removing bottlenecks in their processes. And that's my profession, so that's what I want to use now and try to show you how I would apply the problem-solving tools that I know in such a crisis. A disclaimer here, I am not an expert in COVID-19. I didn't make any research on COVID-19, so I have only a very limited information, like most of us, just from the media, from the television, from the news. So keep that in mind, so I don't pretend that I know anything about how to solve COVID-19 problem, but I definitely would like to show you that there are some useful tools and approaches that could help to solve this issue, and you will realize or recognize already some of them in practice. So let's start. So how to handle COVID-19 crisis using a problem-solving method like Lean Six Sigma. I hope you can read it well. It starts with defining the problem. What is the problem? What we know is people get sick from COVID-19 and some of them die. And we have no vaccine, no treatment to protect ourselves. So that's the situation. To really understand the problem, we also look at the problem from different perspectives and from different point of views. I use there a matrix called customer requirement matrix. You can compare it with CTS from Lean Six Sigma, critical to satisfaction tree. I took two examples here, two participants, stakeholders in this situation. One is the individual person, like you and me, and the other one is the government. And of course the list could be very long. Businesses, agencies, healthcare organizations, whatever. But let's take these two most important ones. And in this exercise you would like to know what are the requirements, or what makes those participants satisfied, happy about the situation, what do they want out of it. And you will look at if there is any contradiction between the wishes and the wants, because that gives something to think about later when you are looking for solution. You try to have an optimum solution for all parties possible. So if I take the individual, what is his requirement concerning the quality of life, the time issues, and cost or effort issues, then the individual wants freedom. Freedom to move, freedom to travel, freedom to do things that he wants. You also want to have a health, good health, of course. Everybody wants that. That's not only physical health, but also mental health. So system that should provide both. Other requirement of the individual is that he is able to cope with temporary restrictions. So with emphasis on temporary. So it's for a short period of time, if possible. Of course, these are requests, wishes. It doesn't mean that everything is possible, but if I am an individual, if I look at myself, I'm able to cope with restrictions, like travel restrictions, like going out restrictions, if I know that it's for a period of time and not forever. Just again, because it would contradict with my wishes to have freedom. I also would like to have fast solution to cure this problem, rapid solutions. I know that it's not possible, but I would like it. Concerning the cost or effort I'm willing to pay for this situation, I'm willing to adapt myself to this situation, to these restrictions, so I'm willing to put effort into it and respect rules. But I also want to understand, so I'm really willing to understand what progress are we making, you know, and I would like not to pay too much effort and energy or cost to understand it. So I don't want to spend hours and days searching the internet and trying to do my own research. I'm lazy, so I think most of us. And of course, concerning cost, I would like to keep my income to pay my bills. Least can go on, of course, what makes people happy, individual happy about their lives, but I just try to pick the most relevant into this situation. If I look at the other participant here, is the government. And the government want to protect their citizens. That should be their goal. And therefore also control this epidemic and have sufficient resources to treat those that are infected by COVID-19. Concerning the time, they want to be in control all the time, so not only once in a while, and they would like to react fast if change happens, sudden changes. And they also would like to have solutions for this illness as soon as possible. Concerning the cost or effort they are willing to pay in this situation, they are willing to discipline, they are willing to bring on new legislations, new laws, and force citizens to respect those laws. So they are willing to do that. They are willing to temporarily help businesses, not forever, but for a few months. They are also supporting, also financing some researches to find a solution for this epidemic. But they also are really willing to protect their political power. That's why they are politicians. And they don't want economical crisis. So this is what government wants. Are there any contradictions here? For sure. My freedom of the individual can crush against the legislation. So if they want to, for example, me to stay at home all the time or not visit my old family or mother, that could be a crush. That's a contradiction. my desire to understand the progress is something I see that it's not really happening yet from the media. So I don't really understand everything that is going on. That's again a conflict that should be solved. I would like to understand why certain decisions are being made to protect me as a citizen. And I don't see it yet, not clearly at least. So these exercises to understand the ideal situation from different point of view and find some contradictions that should be solved or taken into account when we are looking for the solution. We are still defining and understanding the problem, and therefore we also look at the current process. And as far as I understand the process, what happens is COVID-19 infection is detected, government consults all kind of institutes like healthcare, infection control body and that kind of stuff, RIVM in Dutch we call it. Of course they consult other countries with similar problems, so they collect some information and they make a decision on countermeasures like lockdown, yes or no, like social distancing, that kind of stuff. And they monitor the effect of these countermeasures. At least that was my impression from the media. If the trend is downward, is the question. Is the trend downward? No. Okay, they continue on looking for new solutions and taking new countermeasures. If the trend is downward, yes, they are easing on the restrictions, as we experience now. Next question is there a solution like vaccine or medicine found for this coronavirus? If yes, okay, that's the end. If no, then it continues the process. Of course, this is not a complete and not perfect process from my knowledge. This is what I have experienced, what I see. What problems can we get from this process? One is concerning the monitoring of the effect. My concern or the question could be raised from what is being measured. Do we measure the right stuff here? How accurate do we measure it? Is it accurate enough? Do we use the data the right way? Does it really help to make the right decisions concerning countermeasures? So that's concerning this step. A step concerning the ease of restriction is, okay, when do we do that? At what level of error do we allow to ease on the restriction? Are we going for zero defect, zero death by COVID, or are we accepting losses? So that's my two concerns about the current process. So that's where we can also look for improvements in this process. Okay, we learned a lot in the define phase, and now we are entering the measure phase. So this is what I always do, and what we do is really collecting data. So again, here about COVID-19, what data are we collecting? That's a big question, and this is critical really, because it's not only giving you the right picture of the current situation, picture that probably look like this, with high variation of the data, a high number of something in connection with COVID, and we would like to go to a much lower level. This is where we're going. But this is first to look at what is our baseline and what do we measure. From the media, I have learned that we measure a number of deaths per day that are tested for COVID. We measured the number of COVID infected people on the intensive care of the hospitals, or the number of tested COVID patients. Knowing that we don't tested everybody, we only tested a very limited number of people, that the death is not only caused by COVID. So I have big question marks, here. What do we measure that it really gives you the right picture of the situation? At the beginning, with every project, maybe you measure a lot of things just to sort out what is important and what is not important. So analyzing your data is essential, like here as well. So if you have data on COVID patients and deaths, can you analyze, and it has been done already, so it's nothing new, what is the relation to the age categories. So all the elderly people are more affected than the younger people. What is the correlation with additional health issues? If you have more additional health problems, are you more affected or not? The answer is yes, but what do we know more about it? Are there certain health issues that correlate or interact with COVID more than other health issues? Who dies? Who recovers? We should also learn from the data. Who is infecting others much greater than others? Maybe others are not infecting that much. So this is essential to understand the situation, and then based on what we learn from data and analyzing the data, then you can also decide what is our best metric to follow to give us the right information, the right picture about the COVID situation. This is critical. But for sure we will have a baseline, and we want to reduce the baseline to a much lower level, like here. And we will have a path towards that situation. After measuring the baseline, and now we are going to analyze the reasons we are at a much higher level than you would like to be. So the question is, why not at max COVID, whatever the metric is? Why are we not there yet? And the best way to look at this analysis, to look for root causes, is using, for example, an Ishikawa diagram or fishbone diagram, where you can really make sure that you are looking at the situation from different point of view, to avoid any tunnel thinking. You look at from man's perspective, so the psychology of people. You look at from the method point of view, so how we conduct ourselves, how we work together, the way we are working and living our lives. You look at Mother Nature, so that's the external causes. Material point of view goes about all the resources, knowledge, everything that is here in our lives. Machine goes about the system, so are there system related causes? And the last one is the measurement system, so that's about the data, the facts, the statistics. the figures, and how do you come to it, how do you collect them, how do you use it for further in the process. I've wrote down a few. There are of course more causes to this problem. All what I'm telling you now is not to do it on your own. I do it for the presentation's sake, but normally you do it always with a team of people that they have great knowledge and experience on this issue, so they come up with the best causes possible. From my head coming, like, what can I say, for example, habits. We know that it has an impact on COVID infection, so like eating habits or exercising, diet habits. Traditions goes also with what are you doing and what are you eating. My attitude, whether I respect others, whether I respect the rules and regulations. My psychology could have impact on whether more or less people are infected. From a method point of view, how we as people interact with each other. So, how are we studying, going to school, how do we work? What distance are we keeping from each other, and that kind of stuff. Another important cause is do we make kind of cost-benefit calculation that sounds very business-like and not very nice, but everything has cost and benefit. So are we going to save everyone or not? Or is there something in between? How we consult, or the government consults with experienced people. How do they do it? How do they only follow what they say, or do they make their own judgment? Whatever. Who are we testing? How do we test? How we evaluate those tests? How we evaluate between freedom, between control, between economy? How government decides on control measures before somebody gets ill, or after somebody got ill. What do they have to do? Another point of view from the external situation, like population, density of population, could have an impact on the magnitude of the crisis. Age distribution. Are there more elderly people or younger people? And what are the general health condition of citizens? Could also have a correlation with the COVID crisis and the disease. Okay, we're going into the material. Availability of resources like doctors, nurses, equipments on intensive care. Test materials, do we have or not? Do we have enough money for research and development of the vaccine? And what do we know? What is our knowledge about COVID-19? From the machine point of view, the government is a system. How do they operate? What kind of political government system exists that can have impact on the level? How we work in companies, how we work in hospitals, how we work in research organizations, all could have an impact. Lastly, what do we measure? How accurate? We have discussed it already in the process analysis shortly. how does the government uses the data, facts and figures to decide on countermeasures, actions, law, legislation. Those are all possible reasons, possible causes of the problem of COVID-19 and the infection and the crisis. There are many more. What we do in this analysis is try to list them all as much as we know, and then try to cross out those that are having probably low impact or not easily changeable, or could require a long time and lots of investment to really quickly improve the situation. So we are looking for the low-hanging fruit here. What could be influenced quickly with limited time and money to have a reduction on the COVID-19 infection. After this, with this prioritization of root causes, we still in phase of testing, and we do that in the improve phase, where we try ideally create a pilot setting where you test your hypothesis, because until now, if you don't have really hard evidence, then you are still in the hypothesis phase. So you want to test those hypotheses. So if our analysis leads to saying, for example, data and stats analyzing all these infections is an important cause that would influence later the level of infection. So what are we going to do about? Is it distancing? What are we going to do about? Is it age related? What are we going to do about it? One could be a very useful tool here, if possible, to do a design of experiments. So it's kind of experiment that you set up and looking, the whole world is affected, so it could be easily done quickly. And what you would like to test are your assumptions about the important factors. What is the important factor in this COVID situation? Whether I get it or not, whether I infect others or not, whether I am recovering it from or not, and can I avoid it or not. So for example, age is probably a very important factor, or health situation, condition is another important factor. Distance that I can keep is an important factor, and there are probably more, I don't know, for sure there are more. With this experiment you try to test those factors in their combination with each other and see whether which factor has the biggest impact on COVID infection. And secondly, you are looking for interaction between these factors, because interaction means one affecting the other and therefore affecting the outcome. So how they combine, for example, if I'm old and have many other health problems, that's an interaction. I will have greater danger to get affected by COVID. But this design of experiment could very much help to find the main causes, and then if we conduct this analysis and we see that distancing is an important one for age above 80, I don't know, then you can be much better in formulating your actions and formulating your countermeasures. Not like now, everyone should stay away for 1.5 meters from each other. But we know that children are not easily affected, or at least they recover very quickly and don't easily infect others. So it's not that black and white. This analyzers would help to refine those important measures like distancing. So this is what you do in the improve phase. You try to test your hypothesis by making changes, like keeping the distance, like closing big group events, something like that. And what you want to make sure is that you still keep on measuring your metric, your COVID metric. You know what we discussed in the measure phase. Because you want to see that the trend is downward after taking these actions. And if the trend is downward, then the action is okay. If not, action makes no sense because it will not have any impact. So this is the critical part in finding the right solution. Taking action and looking at the impact. Taking action, looking at the impact. If you see the downward impact, then you can be sure that you can control, at least improve the control on the situation. And the control phase, the last phase, is where you also try to formalize and administrate your findings and what achievements you gained. Control plan looks very simple. Is you are looking at the output and the input parameters. Output is like our COVID metric. This is what we would like to minimize. This is our goal. And how do we measure and monitor this? We want to continually monitoring it. So we should have daily figures, daily data. And what are we going to do? What corrective actions are we going to take if we fail? If we are seeing an increase, for example. Okay, then probably we would consider putting more restricting actions. After this, in this control plan, we list the actions that were delivering a downward trend on our COVID metric. So those that helped. This is an example, for example, distancing. Okay, what is our goal? To keep 1.5 meters. How can we measure it? What are we going to do if we see that it's not possible? Protection, when do we use it? Like masks to avoid it, or quarantines to avoid infecting others. How can we measure it, and what corrective actions are we going to take if we are not complying with these rules that we agreed on? Again, this is just to demonstrate how tools from Lean Six Sigma can help in crisis like this, and I think you see the logic behind all the steps, the logic behind the tools. If you want to learn more on this, go to herkuxl.com. herkuxl.com. Thank you very much. Take care.